Yeah. There, yeah.
Excellent. And Floris is Wolswijk? Is that how it's pronounced?
Wolswijk.
Wolswijk. Thank you.
Yeah,
All
perfect.
right. Hello, everyone. Welcome to the Psytelligence podcast. We have Floris Wolswijk here with Blossom. They are on a mission to democratize and sort of centralize and make accessible psychedelic research. They have some great databases. They have great reports. And I think their model is really fascinating because it's an open, generative model that seeks to build consensus and to share knowledge freely. And so, without further ado, here's Floris to tell us a little bit about himself and what they're doing over at Blossom.
Yeah, Eric, thank you so much for having me on the podcast. And with Blossom, as you said, I wanted to create a place where everyone could access psychedelic research. If you're a student, if you're a practitioner, a researcher, a policymaker, everyone coming from different angles to be able to access the psychedelic research in a central place. So to either go into depth to look at a single article and see a summary of it, get the information from that specific research area, or go more broadly and look at what is all the research that we have on, say, psychedelics and depression, or all the research we have on MDMA and all the different topics it applies to. So for the last 4 years, I've been building out the database, now featuring about 2,000 research papers and then about 50 overview pages on those different angles. It all came from my own passion of wanting to dive into the psychedelic research. My background is in psychology, but maybe guess more in entrepreneurship, having been building a company for the last 10 years. And yeah, just I just also wanted to know like what's the research on psychedelics? As a psychology students back then, but I guess still even today you hear nothing about psychedelics, right? It was studied in the 60s, 70s, but of course now again we have more than 2 decades of psychedelic research. So wanted to make it accessible for the different stakeholders. And yeah, try to make as much of it as freely available for everyone. And then doing some consultancy next to it and sort of building out the ecosystem. And I guess we'll go into more depth, but one of the most things I'm most excited about is how do we go from the research to the implementation? How do we not sort of stick within academia, but also make sure these become approved therapies, which I guess we're sort of on the brink of that change happening right now.
Excellent, thank you. And so you do the research database. There's some reports. How are the reports different from the database?
So, for instance, we have a report on psychedelics for depression, and there we summarize all the research and try to make it accessible to everyone. So both saying like this is where we stand now, if it's at phase 2, phase 3, and how many participants have been in there. And also, what can we say? What if you look over all the different studies? What is it that we can expect? And then a part that will become more and more prominent is like how will this be implemented? Like where do we stand in that whole process, right? So for instance, now with the new map study coming out, and we can say, for instance, for psychedelics for PTSD, like that we're one step further along that line. So making it possible to see that too. I guess we also cover a bit, but our friends at Psychedelic Alpha are better at this. Also cover like what are the companies doing to progress this, right? Like who's actually making sure this goes through the FDA process, etc.
Absolutely, I agree. That Psychedelic Alpha is an amazing resource as well, and they've been out there in the forefront doing a lot of the sort of business analysis and seeing where that actually gets traction and all these things come together. And that's something I love about your model is it's so open and inclusive. So you have partnerships with Psychedelic Alpha, with Psychedelics Today, a whole host of organizations. What was building that consensus like, and why was that important?
I guess it all developed organically as different people look at different parts of the industry and want to contribute in different areas. And I want to bring all of that together. So it sort of naturally evolved through that and think, yeah, one thing that I try to do a lot is to work together with the conferences on psychedelics and see like, can I just send people there and make people like connect in those different areas, and also help organize a day for ICPR, the Dutch interdisciplinary conference on psychedelic research.
Excellent. And so I note that that differs from a lot of the economic models, right? And particularly within sort of the capitalist mode of traditional modern economics. And it's not as much of a competitive as it is more of a collaborative model. How does that factor into the success of the ventures? Does it change the equation?
Well, I guess I came to this area with more of a passion mindset and wanted to contribute to the space. So that's why I wanted to make as much as possible open for everyone. So I think that's the reason behind it. Still, at the same time, you want to say, like, oh, is there something that I can contribute more directly, say through consultancy and working with others? So that's still like figuring out what are the different modes that can work. But I think also for psychedelics as sort of the theme we're working on, it's a place where there's a lot of collaboration. So I think in that way, it also makes sense to have a platform that's really open and accessible for different stakeholders. Because a student isn't able to say pay for a database to get all of that access, and I do want them to be able to get that information. So that's sort of the my contribution to the space.
Nice. And on the issue of access, there's a broad spectrum of folks. There's indigenous populations who've been working with psychedelics, previously for years. There's the sort of community that's been operating in the gray area, outside of legislation. And then there's this large move in the clinical space to bring it in and monetize it. Are there any organizations that you think would deserve a good shout out that are doing work on access, on accessibility, particularly for indigenous and underserved, traditionally underserved populations?
Yeah, I think there the conversation is mostly about decolonization and sort of in that way making things better. Um, I guess the treat initiative there is, well, they're also more on the medical side. Yeah. So I wouldn't exactly have a good answer for that route, but I guess the treat initiative is one of the things that came up. Like they're making a lot of money. I think that the aim is to get 5 billion of um, taxpayers' dollars out to for the research, which then of course can have trickle down effects on making psychedelics more accessible and be more accepted in the general for the general public. And I guess the other thing that came up in terms of making it accessible is NTA, which is working on getting insurers to pay for psychedelic treatments. Now, of course, with ketamine, which is available, and they've now have national coverage. So that's sort of the first step to really make that happen, which then could lead to the rest of the medical model working. I guess more broadly, it is an area that's a bit further away from me. I'm based here in the Netherlands. Because you or probably other guests will know better how it can make it more accessible for other groups.
Absolutely. And so, broadly, with the work that you're doing, what's going best? What do you feel is like really successful or exciting or inspiring in the space?
So I think it's exciting, and also probably will open it up to the next question. Is the study results? Like they are exceptional. The seeing that two-thirds or even more don't have their PTSD indication anymore on the CAPS-5 score, that's just incredible. And that is for an audience that a lot of them were treatment resistant, at least in the first part of the MAPS phase 3 trial, and the second part there were people who weren't treatment resistant, but you could also see that their scores were about at the same level at the start. So they had a very high PTSD score, and then after the study, it was really, really low, so not even clinical anymore. So I think that's sort of the big promise of psychedelics. And I guess I'll turn over also to like the difficulty. It's that trials are still really, really small. So for psychedelics, we have maybe a handful of trials over 100 people, and that's sort of nothing within traditional pharma. J&J did their studies with esketamine, and I don't know what the exact number is, but we say about 3,000 people went through those phase 3 studies. So that's a larger number than we have with psychedelics, but of course that's also a shorter duration study where the actual treatment moment is maybe 2, 3 hours, whilst with psychedelics it's a full day, and there's a lot more contact moments. So I think that's the difficulty, and also getting that funded. So that's the balance now, right? Like, how do you get psychedelic medicines to go through that rigorous process if you want to go the medicalization route? Um, and there's still a lot that needs to happen, but at the same time, a lot of positive developments of, say, Blake Miskowski saying like, I will donate 100 million over the, say, next decade. I think that's a great development.
Nice. What do you think are some of the challenges internally or the blocks? What's leading to the smaller scale studies? What's still potentially in the way there?
Think the business model is still quite difficult to see how it's profitable for pharma companies. So some large pharma companies like Otsuka from Japan, they've started some investments and in some companies, but it's all quite limited because it's not that you're developing a drug that you can patent unless you're developing a second generation psychedelic, but then you still have to go through the whole process again. And then with MDMA and psilocybin, they can only um, get data exclusivity, which is between 5 and 8 years, depending on where you are. So that could be a model to say, like, we have to get back our money in that amount of time. But yeah, that's also not as sort of promising as for other drugs that are being developed in, just between brackets, normal pharma. So I think that's a big challenge to get the incentives there for them to contribute. Then you have to find it with people who want to just do it because they think this is the right way forward, but not expecting a return on their investment. So I think that's the sort of big challenge now. And I guess within the research, it is that blinding the studies is virtually impossible. A lot of them don't even monitor it, which again is also a bit questionable. But if they monitor it, they see that about 80 to 90% of the participants, they know which part of the study they were in. So there are some recommendations from the FDA and here in Europe from the EMA, so it's the equivalent to the FDA, on like how to do that well. But they need to have convincing data to even approve it, and then to go ahead.
And what's your perspective on the global landscape? Because there's sort of different cadences and paces. There's interesting activity in Australia, obviously in the EU, in the US, some kind of stop and go messages. Hey, like recently in California, where Gavin Newsom, said, hey, if they're, decriminalized at the federal level, but then did not decriminalize them at the state level. So what do you see as far as that whole constellation? Are there things that can be done to help globally, or does that actually hold some things up that there's no consistent regulation?
Yeah, it would be better if the regulation and the data between the US and Europe could like move freely and it would be accepted in like both areas. For instance, now the UK has dropped out of the EU system with following Brexit. So they are now saying we'll accept data from the EU and from the US and just rubber stamp it and then have a medicine be approved. So for instance, that could be positive there in terms of MDMA getting the FDA approval and then quickly also being implemented in the UK. But for now, there isn't that. I think it's called data equivalency. So I think that's still quite a barrier, although there have been positive signals of MAPS only have to do a relatively small phase 3 trial in Europe and then also using the US data, so they're combining both of them together. So I think there's still a lot that can happen there. And I think if I compare Europe versus the US, there's so much more, I guess, entrepreneurial spirit in the US of the original dream, like just to do things that you make that happen. Whilst here, there isn't that much in that way. On the other hand, there is a really good sort of coverage, say, for instance, here in the Netherlands, of psychiatrists, of mental health care, which then could be tapped into by drug developers. And actually, there is a consortium being like started right now of like doing larger studies and bringing all of that together so that there could be studies, for instance, a lot of them happening in the Netherlands, but then going for EU-wide approval. So there are things happening, but I think if you want to like be where the action is, you still have to be in the US.
Interesting, nice. So it really is. We can help each other kind of globally advance this, particularly through the models that you're kind of sharing, which is get all the information together, and just that rising tide helps all boats. And you mentioned earlier on the challenge side of there is a bit of dearth of really in-depth or longitudinal clinical research happening right now. Is that how does that relate to how would we say maybe cultural biases against psychedelics, and or awareness in the public? Does that affect the funding, the research, the access, and if so, how so?
I guess from if you look at the stigma of psychedelics, then just them being classified as one of the most dangerous drugs and being in the Schedule 1, I think that's the big hurdle of doing research with them. So for instance, ketamine, there's so much more research on it because a researcher could just call up the pharmacy at the university or somewhere close by and just say, please give me some ketamine for this study, and then it'll like go through. And with psychedelics, that's way more difficult. So I think that's sort of a big hurdle there. The other hand, it's been not that long that a lot of research has happened. So for instance, for MAPS, they have some longitudinal data on the phase 2 studies, but then say for Compass, they haven't had yet time to look at the data over the long term, although they're after 12 weeks they already saw sort of non-significant, so maybe they don't have positive data for longer term. But I think that's also very important for this conversation. For instance, for ketamine, the most of the data and also the approval is based on a relatively short-term alleviation of depression and also suicidal ideation, which of course is really important, really valuable. But with psychedelics, if you would have to make the case that it's effective, then you don't want to say it's effective for 12 weeks. You want to be able to say it's effective for a lot of people in 12 months or even 5 years or 10 years. Because also the treatment with psychedelics will be, at least as how it's being done now in research, will be quite intensive. So it will cost a lot of therapist hours. And those aren't cheap hours, especially with the regulatory requirements right now of someone quite qualified having to be there. Then if you compare that versus SSRI treatment and seeing a psychiatrist 15 minutes every 2 weeks, that's way more cost. But on the other hand, there have to be that relief, and the less burden on the medical system on the other side. And if we can say that the lesson of the burden lessening will be there for 2 years or 5 years versus 12 weeks, that's a really like big multiplier.
Because then the equation becomes, as you mentioned earlier, for insurance payers, for employers, for self-insured groups, all of them start seeing the math and the costs go way down, the safety and the
Mhm.
efficacy go way up. And it's
Mhm.
interesting because ketamine also has, cultural biases against it, as a horse
Mhm.
tranquilizer, as a rave party drug, as well as MDMA. But I don't know, is it because they're newer? There seems to be a less of a cultural bias and easier access to those substances than there are some of the more
Mhm.
traditional plant-based ones
Mhm.
that are more challenging potentially to patent, and also then have a longer legacy of use with indigenous populations, and again those people operating in the gray area of the law.
Mhm.
And so it may not be that it's just the cultural bias, because they both have negative biases, but I do see an interesting sort of delta there between the two. And that'll be sort of interesting to watch.
Yeah,
And
but maybe to note on ketamine, like when it came around end of 60s, beginning 70s, it was introduced as a medicine and like immediately went into that schedule as a medicine and has been there almost everywhere around the world for, so there's also maybe the inertia there that is just staying there. I think Russia and maybe a few other countries have put it in a more harsh schedule and like then prevented it from being used as a medicine. But I think that being a medicine and staying there has sort of positively affected it, while psychedelics then at the beginning of the 70s were like put in the most dangerous group, and now trying to get their way out of it.
Interesting, yeah, and you know, some of the things that happen with psychedelics sort of correlate with some of the issues of why it was so criminalized. Because you
Mhm.
know there's a you know sort of there's a control mentality or a sort of escape mentality,
Yeah.
and the ego death can be very threatening to control models when actually it doesn't have to be.
Mm.
And I think that one of the really interesting things is how many on who are utterly divided on the political spectrum are together on psychedelics. And I
Mm.
love how people on the left who are maybe using it for personal actualization, and then there's also folks on the right who are using it for recovery of first responders. And war veterans, right? And so,
Mm.
one, I think it's the broad, benefit of psychedelics that helps that, and it's also just shocking because you really don't see that sort of sort of cross the aisle thinking, if you will,
Mm.
elsewhere. And so that leads me to my favorite question, which is wave a magic wand. What does success look like in psychedelics? Like what does the ideal state look like if all these obstacles go away?
Ooh. Um, I guess in different areas, I guess first the medical side of things, like that there will be approved medicines that are ensured that everyone who needs to can access them. Yes, with the magical wand, they would even say they could be treatments for people who haven't even tried all different options. So that's something that's being explored. Like, can we use psychedelics not as the thing your GP gives you when you walk in the first time, but also not when you have tried 3 SSRIs and have failed with all of them, so that it could be used earlier? Because I think there are signs that it could still be positive to do that at an early stage, even. So that's ensured and that it's effective and yeah, relieving people with mental health issues for which about a third of people at the moment just have no options. Because beyond mental health, for chronic pain, also for different areas where we see promise with psychedelics at the moment. Um, I think more broadly for people to be able to use themselves for self exploration and to do that in a safe container where there's regulation around it, where it can be used responsibly, not even for when something's going bad, but even for people themselves to do self exploration, to grow, to sort of get more joy out of life. I think that's one thing we have here in the Netherlands. We call it the polder model, which means trying to keep everyone happy at the same time. And that's what's been done with psilocybin containing truffles, where people can just buy it in the shop. Usually there's a nice shopkeeper who can tell a bit about if people are like newer to it. And generally we see that people aren't hurting themselves, and generally also based on survey data, of which Johns Hopkins recently did a large survey study, see that people after the use of psilocybin containing truffles, or then in the US it was also mushrooms, they're generally better off than before. So that will also be really awesome to see. So both the medical and the recreational self-development use of psychedelics.
Excellent. And that makes me curious. And for me personally, I got into the space. I've been doing traditional genetics medical research, but then I found for me psychedelic therapy. I was struggling with treatment-resistant
Mm.
depression. Post-COVID, my usual bag of tricks weren't working,
Mm.
and I found tremendous relief. And I was shocked when I looked at how safe and effective a lot of these were based on already known, data and research, and that they weren't accessible, and that even they were dismissed by traditional, psychologists. And so
Mm.
that's what inspired me to get into the space. Is there a similar
Mm.
connection with you, if the question's not too personal?
No, of course not. So I think partially, like I've been personally taking psychedelics for over 10 years, and I guess I've been able to use them and see the world through different perspectives. but I haven't had a big change. I've been like generally happy and joyful, but still see it as a awesome thing that you're able to do this in the comfort of your home and feel safe there and have that be something you can do from time to time that or maybe also like one thing I also enjoy is that it connects you with other people around you and you could have that shared experience in an altered state of consciousness. So I think that's a really positive thing that it has done for me. And then what you also said about the perspectives of psychologists and psychiatrists, like they are changing. So a 5-year follow-up study was recently done, and there you see that public perception also for those healthcare professionals changing. So I think the one that sometimes the media attention can be overwhelming and makes it look like everything is perfect. But that generally it is a positive thing, and I think that's also something that's now being transferred to the medical health professionals. And think there's more and more education also for them to know what psychedelics are and hopefully be able to implement them in the relatively near future.
Nice, thank you. And we're kind of reaching the half hour here, so just want to circle back. One, thank you for sharing your time and expertise today. We mentioned some friends at Psychedelic Alpha, Psychedelics Today, Maps, and please also then tell folks about your Blossom and how they can get in touch, how they can connect, and how they can participate.
Yeah, so everyone can find the website at blossomanalysis.com. And then you can sign up to our free newsletter and get it every week with the latest psychedelic research, a bit of updates on everything around it that's taking place. So people can just freely get the information there, browse the website. If they want, you can become a supporting member. That's also possible. And one thing that we recently upgraded is our psychedelics courses website. If people want to learn more about psychedelics, there we have a directory of all the courses that are out there, from free courses on YouTube or from the Berkeley University, for instance, but also courses on therapist training, for instance, if people want to get involved more.
There it is, folks. So that's Floris with blossomanalysis.com. You can check them out, a ton of free resources, membership. You should definitely subscribe and contribute to this great organization. Lots of classes and training going on. So check them out, folks. Don't miss them. And again, we're very fortunate here on the podcast to have your expertise, Floris. Thanks again so much.
Yeah, thank you.